Good morning, and thank you for being here. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are here at Alden Estates of Northmore Rehabilitation and Healthcare Center in Norwood Park. We're here today celebrating vaccination of long-term care facilities. Yay! Joining me are a number of folks from the leadership of Walgreens, and speaking will be Rena Shaw, the Walgreens Group Vice President for Pharmacy Operations. Leadership from Alden Estates of Northmore, and speaking will be Tanae Tillery, the nurse who was specifically involved in vaccinating residents here just now. And then Dr. Geraldine Luna from the Chicago Department of Public Health, who will be providing some remarks in Spanish. So there is nothing that I care more about than getting long-term care facilities vaccinated in the city of Chicago. And today, we just saw 5 people get vaccinated ceremoniously at this facility, 2 nurses, a laundry aide, and 2 residents. And that reflects our goal to see high uptake of vaccine for both staff and residents at our long-term care facilities. We have 78 skilled nursing facilities in Chicago, 128 skilled nursing and assisted living facilities, and more than 250 other long-term care facilities. So it's a lot of work to get vaccine to these partners, and Walgreens and other pharmacy partners are playing a critical role in terms of bringing strike teams and then partnering with the leadership at each of these facilities. Vaccination of long-term care residents and staff is critical, not just to protect some of the most vulnerable Chicagoans, but because this is one of the most important ways to decrease cases and death here in Chicago. Just across our skilled nursing facilities, that's our 78 in Chicago, we've had more than 8,900 confirmed COVID cases, more than 5,800 in residents, and almost 3,000 in healthcare workers. We've had almost 2,400 residents hospitalized with COVID and more than 1,100 die. We've had more than 165 skilled nursing facilities staff hospitalized and 17 die. Now we have vaccine available, and we are making vaccine available with all of these partners to every resident and every healthcare worker and other worker in every long-term care facility in the city of Chicago. I couldn't be more pleased that we're able to do that, and I am very much hoping that we will see excellent uptake at these facilities. We've just gotten started with this, and we have had some facilities that have had as much as 80% of their residents and staff, even on the first visit, raise their hand and say, "I'm ready to get vaccinated." We've seen lower uptake at some facilities, and we've been working hard with partners to answer questions. I expect people to have questions about vaccination. I welcome them. I want people to have the information and feel confident in receiving the vaccine. We did a town hall yesterday specifically for long-term care facilities, answered questions. We're putting out materials in different languages and making sure that all of our partners really in this have the right information. We're thrilled to be partnering with Walgreens and CVS to deploy these strike teams, and we hope that events like this will help demonstrate to residents, to staff, and importantly to the families of residents that the COVID-19 vaccine is a safe and effective way to reduce the risk of COVID. Safety remains our top priority. No steps have been skipped in terms of developing or testing this vaccine, and no safety steps are being skipped as we administer this vaccine. We do see some people having slight side effects for a day or two after getting the vaccine. That's not a bad thing. That's your immune system responding to the vaccine. It is impossible to get COVID-19 from the vaccine. I got my first dose the other week. I feel great. I had a sore arm for about a day, didn't really have other side effects. But even if I had had some side effects, small price to pay to know that I am protected, and particularly in a setting like our long-term care facilities where we know that the risk continues to be high. I'm really excited that vaccine is available. And with that, I'm really pleased to welcome Rena Shaw, Walgreens Group Vice President for Pharmacy Operations.
Thank you so much, Commissioner Arwady. I really appreciate this and really appreciate your partnership through this entire journey. For everyone, my name is Dr. Rena Shaw. I am the Group Vice President of Pharmacy Operations and Services at Walgreens. And today is an incredible example of our effort at Walgreens to help our communities get back to their new normal and being able to administer COVID-19 vaccine to those that are the most vulnerable of being at risk of the virus. It gives us at Walgreens a huge honor for us to be able to play a role in helping our communities get better every day. Our pharmacy team members are in the facility right now, but they're also embedded in all of our communities nationwide so that we can be able to provide this incredible experience, not only by providing immunizations, but also being able to provide hope and being able to provide security so that our patients are protected. And so today, we're extremely proud to partner with the City of Chicago, as well as the CDC, as we go ahead and start administering COVID-19 vaccine to long-term care facilities in the City of Chicago, as well as cities nationwide. In Chicago, as we discussed it, the effort started last week on December 28th, and in the upcoming weeks, our Walgreens pharmacy team members will be going to skilled nursing facilities, assisted living facilities to ensure that the residents and staff members are protected. And a part of this effort is to ensure that we will be hosting not only one clinic for dose 1, but we will also be hosting a second clinic to make sure that our patients get their second dose, and then a third clinic to ensure that anyone that missed a dose, we can ensure that they receive their vaccination as well. So we're really excited to be able to play a role to support the clinics going forward. And with the guidance with CDC, we have prioritized our skilled nursing facilities initially because it is important that those populations are the most vulnerable, that we start off with that population, and then we will continue to build upon that with our assisted living facilities after that. Throughout the country, we expect that by January 25th, that all of our skilled nursing facilities will be completed with their dose 1 clinic. And so our pharmacists, our team members across the country are working diligently to ensure that our patients are protected and managed appropriately. And in Chicago, we have 42 skilled nursing facilities that have selected Walgreens pharmacists and team members to come on site and protect our residents and our staff members. And to date, we've administered over 5,500 vaccinations. So we've protected over 5,500 individuals from getting the virus, and they're on their journey. So as a pharmacist myself, I'm incredibly proud to be a part of this. I'm incredibly proud of our pharmacists and our team members and being able to provide this service to our communities. And all of us at Walgreens look forward to being able to help communities through this pandemic and being able to serve our patients going forward. So thank you so much, and now I'll turn it over to Tanae.
Good morning, everyone. On behalf of the Alden Network, I first would like to thank both the City of Chicago and Walgreens for giving priority access to the COVID-19 vaccine to our residents and our staff. We have seen firsthand the devastating impact of this virus, and we are so incredibly grateful to have available a vaccine that has proven to be safe and effective against COVID-19. To my fellow healthcare workers, especially those in long-term care, who I hold near and dear to my heart, you have proven time and time again to be heroes through this pandemic. When faced with this unpredictable virus, you all have rose to the occasion and become more than just caregivers, acting as barbers, counselors, advocates, friends, virtual chat organizers, and hallway game conductors. Throughout this pandemic, you have adapted quickly, and I mean quickly, and have done everything in your power to keep our residents and one another safe. And we cannot stop now. In fact, the time is now for us heroes to become champions by getting vaccinated. This vaccine has shown to provide a great deal of protection against this virus, and the more of us who get vaccinated, the better we can protect one another and our residents from COVID-19. So to those healthcare heroes that have and will be vaccinated, we thank you. Our residents are depending on us to act in their best interest. For those still undecided, a little on the fence about getting vaccinated, I urge you to talk with your doctor, your local Walgreens pharmacist, or visit the FDA, CDC, CDPH, or IDPH websites for more information. These are very valuable resources that we have, and they are committed to making each and every one of you comfortable with the decision that you make. In conclusion, we are all still in this together, and we need to continue to support one another in the fight against COVID-19. Thank you for all you have done and all you continue to do. Our residents are depending on us. Thank you.
Muy buenos días a todos. Yo soy la doctora Geraldine Luna, directora médica del Departamento de Salud Pública de Chicago. Hoy estamos aquí celebrando la vacunación de residentes y personal del Centro de Cuidado a Largo Plazo, que es fundamental para reducir el COVID-19 en nuestras comunidades. La mortalidad sigue siendo la más alta en afroamericanos y latinos. Pero aún así, la aceptación de la vacuna por este grupo, por nuestro grupo, es la más baja. Los centros de cuidado a largo plazo siguen teniendo el riesgo de los brotes más altos de COVID-19. Los residentes y el personal pueden reducir su contagio y los brotes al vacunarse. Queremos enfocarnos donde podemos tener el mayor impacto. Y eso es los centros de cuidado a largo plazo y los centros de enfermería especializada como los que estamos viendo aquí el día de hoy. Alden Estates, Northmore. Aquí es donde podemos crear el mayor impacto y empezar a ser embajadores de la salud. Empleado de la salud que me escuchas, latino, afroamericano, cualquiera que sea tu etnicidad, de habla hispana, necesitamos convertirnos en héroes para nuestras comunidades. Necesitamos convertirnos en embajadores de la salud. Estamos muriendo y esto es una crisis. Es un gusto asociarnos con Walgreens y CVS para desplegar equipos de impacto de más de 300 centros de cuidado a largo plazo y enfermería especializada y otros centros de atención médicas de la salud. Esperamos que el evento de hoy demuestre el personal, los residentes y las familias de los residentes de las vacunas que es segura y eficaz en reducir el COVID-19. La seguridad es y seguirá siendo nuestra principal prioridad. No se omitieron pasos al desarrollar la vacuna y sabemos que eso es una de las barreras que estamos viendo en las poblaciones latinas y afroamericanas. No, los estudios se hicieron rutinarios y en forma con mucho escrutinio. Algunas personas han tenido un poco de fiebre, escalofrío, cansancio, dolor de cabeza después de haber sido vacunadas. Estos son síntomas menores cuando los comparas con los síntomas asociados al COVID-19 y la mortalidad a la que te expones. Estos efectos secundarios no son alarmantes. Es tu sistema inmunológico respondiendo a la vacuna. No se puede contraer el COVID-19 con la vacuna, eso es otro mito. La comisionada Arwady recibió la vacuna la semana pasada y se siente muy bien. Tuvo un poco de dolor de cabeza, pero eso es de esperarse. Sabemos que la gente tiene preguntas e inquietudes y eso es normal. Lo que pedimos es que conozcas los hechos de la vacuna y platique con sus compañeros, platique con gente, con profesionales que le pueden ayudar a tomar la mejor decisión. Hay mucha información específica para proveedores, para el público en general, para cualquier persona interesada en salvar su vida y en salvar la vida de los que más aman. Hay mucha información específica en chicago.gov/inclinada COVID Vax. Vax con V de Víctor AX. Esto es una parte del compromiso de la ciudad para la distribución equitativa de la vacuna del COVID-19. Gracias.
All right, thank you to all of you. Happy to take questions for any of us, really.
Maybe you could start out by just telling us why we're outside on this beautiful morning.
Sure. So we're outside at the skilled nursing facility because we are following all of the appropriate COVID safety precautions for skilled nursing facilities. This is, again, where some of our most vulnerable residents live, and there are strict requirements related to testing and screening, and we wouldn't want to bring in, lots of people and even have any potential for putting residents at risk. So we are following all of the appropriate COVID safety protocols, and I want to thank the team that has figured out how to do a press conference, including vaccination, while following those protocols.
This is from WLS. How many doses are sitting in freezers waiting to be administered? Why not allow hospitals to skip phases if they have extra doses due to vaccine hesitancy among other?
Okay, so there's a number of stages to this. Every week, the city of Chicago, just like the state of Illinois, is allocated vaccine. Our goal is to push at least 95% of that vaccine out every week, and we have been doing that. When it goes out to hospitals, we have then asked them to prioritize. And so we started, of course, with the healthcare workers at highest risk for COVID exposure, people who are working in ICUs, in emergency departments, seeing COVID patients. Once hospitals were through those staff, they were able to move on to other hospital staff. And now we are at a point where vaccine has been offered to all hospital workers. We are able to move on to outpatient healthcare workers. And so what we are really asking is that if there is vaccine that is not used this week in hospitals, they have been encouraged to begin vaccinating outpatient healthcare workers, even as we're also working to send vaccine directly to healthcare providers. I'm able to have the best look at what vaccine is sitting really at the Chicago Department of Public Health. Again, our goal is never to have, more than about 5% of what's been allocated available. We push that out through our community points of dispensing and mass vaccination sites. So I don't know at any given hospital what the specific number will be, but I will say we have not seen as much uptake as we necessarily expected right at the beginning, particularly in our hospital-based healthcare workers. I want to say to hospital-based healthcare workers that it is not too late to get the vaccine. If you were waiting to maybe see your colleagues get a second dose or you weren't quite sure, please take that vaccine now if you're feeling more comfortable with it. But what we do is follow along every single week how much vaccine is available, and then we expand out once we're done with the prior stage. So the expansion right now, we still have more than 60,000 outpatient healthcare workers who need to be vaccinated. We still have many other congregate settings that are being vaccinated, and that is our focus for this week. Once we are getting to a point where we are through that, then we'll be looking to move ahead.
This is from the Tribune. Is CDPH still following federal and not IDPH guidelines for seniors in 1B, phase 1B? If so, is there concern that whether someone who's 65 to 74 will qualify for vaccine sooner depends on if they live outside Chicago or not?
Yeah, thanks. We're getting a lot of questions about that, and I want to be very, very clear on where we stand here. So the state earlier this week said that in phase 1B, people 65 and older can be within that phase. Chicago is in agreement with that people over 65 will be in phase 1B. Chicago and Illinois also both are on the exact same page when it comes to putting equity at the center of our decisions. And what we are doing is looking within phase 1B about how to potentially prioritize, just as we've done in 1A. So you heard Walgreens here started with the skilled nursing facilities, the highest risk facilities, and then we'll be moving to the assisted living. Once we're through that, we'll be moving to some of the other congregate care settings. On the healthcare side, in 1A, we started with hospital-based workers. We are now moving to outpatient healthcare workers. We'll be doing the same thing in 1B. And even as the whole phase will be open to those over 65, we will be asking our healthcare partners to prioritize first and foremost those at highest risk of poor COVID outcomes. And an easy way of doing that is encouraging them to look to those over 75, but if they have people who are in that 65 to 74 range that are high risk, it can also be open there. I want to highlight though, first and foremost, we are looking at this data every single week. The city and the state are absolutely on the same page with the goals of number one, not having vaccine go to waste or sit on shelves, I should say, and number two, really thinking about equity. And here in Chicago, we have about 155,000 Chicagoans who are over the age of 75. We have about 360,000 Chicagoans who are over the age of 65. We're getting about 32,000 doses of COVID vaccine per week. And we have essential workers we need to continue with. And so where we think about the hardest hit communities, right now, especially our Latinx communities are very hard hit in Chicago locally. We have a lot of essential workers who are actually under 65, but are working in manufacturing settings and grocery stores. And just as we're continuing to prioritize, we will be starting with older Chicagoans and these essential workers at the same time. So you will be hearing much more detail about what that is going to look like, but the city and the state are not in opposition here. We are thinking here about how, just as we've done in every phase so far, we'll continue to do, how to further prioritize within that phase, and there will be more details coming when we're at a point to move there. This week, next week, we still have tens of thousands of outpatient healthcare providers and congregate settings.
Also from the Tribune, what can you tell seniors about how they will sign up for the vaccine when it's their turn, especially if they don't have a regular healthcare provider?
Sure.
What plan is in place to ensure situations in other states of jam, hospital phone lines, so people can't get out overnight?
Yes, we definitely do not want jammed lines and people camping out at any point. So all of the COVID-19 in phase 1B is going to be available by appointment. This is not going to be come one, come all, whoever can get in line first. And most, especially for older Chicagoans, that vaccine is primarily going to be available through your healthcare provider. So what we're doing right now at the Chicago Department of Public Health is enrolling all of these outpatient providers. There are hundreds of outpatient providers. These are the people you normally would get your flu shot from, your tetanus shot from. Those are primary care providers. Those are also pharmacies. So our Walgreens partners, our other pharmacy partners, we are getting them enrolled and getting them vaccine so that we can make vaccine available, especially for older Chicagoans, but it will be by appointment, and there's not going to be enough vaccine for everybody at the beginning. I want to be really clear about that. We will also, on the employer side, be working to pair vaccinating partners with employers on the essential side. So you haven't missed anything if you're afraid you haven't signed up yet for a vaccine, but the opportunity, when we are able to move into that next phase, we'll let you know, and that will broadly be through your healthcare providers, and we'll be asking your healthcare providers to prioritize themselves about the older people in their panels and the people who have more underlying conditions.
Okay, this is from Block Club. IDPH plans to vaccinate incarcerated people and/or people experiencing homelessness during 1B. Is CDPH planning or considering doing the same?
CDPH is absolutely doing the same. Again, I think there's been a lot of goal here to try to set the city and the state on different parts. We are on the same page here. It's about prioritizing within phases, but we are already vaccinating in correctional settings. We're doing healthcare workers in correctional settings. We'll be moving on to staff probably as soon as this week. And then, yes, moving on to detainees immediately after that. And it really does continue. When you have a stream of vaccine going, that's how it works. You start with the highest risk, and then you really keep moving from there. Similarly, our homeless shelters, we consider a congregate setting. setting. Not as high risk as a long-term care, that's why we're starting here. But once we get through the long-term care facilities, we're then doing the congregate settings that are for behavioral health and developmentally disabled folks. And then, yes, we are moving on to homeless shelters, as well as convents, other congregate living facilities where we've seen outbreaks in Chicago. They are on a continuum, and absolutely, planning is already underway to make sure they can get vaccine. Not just the residents, but the staff, not just the the people at the shelters, but the staff.
Also for the block club, will CDPH prioritize college professors for vaccinations during 1B, or is that limited to teachers for high school and young?
So we'll be starting broadly with daycares, where have we seen people working throughout the entire outbreak here, and wanting to make sure that we're protecting those individuals, as well as K through 12, really recognizing, again, many of those schools have been open throughout, and obviously having students we feel strongly about making sure educators are in that role. The college folks would be broadly in that educational tier, but not highest in that tier. So we'll be again working within each of these larger groups to be ordering based on risk and priority, and more detail to come about each of these tiers.
Okay, WBEZ is asking about to react to President was kind of breaking news. President-elect Biden saying that he will release all available doses when he takes office on January 20th, as opposed to the current administration, which was holding back, I guess, on second doses.
Okay, so that is news to me, standing up here. But what I can say, we are anxious to get vaccine here in Chicago, right? I just said we've been getting 32,000 doses a week, and we want to push vaccine out. We obviously have to make sure that there is second dose available, and we are working to do that behind the scenes. Anybody who received the first dose 3 weeks ago from the Pfizer vaccine, we have already shipped out enough vaccine for them to get their second dose this week. We will absolutely continue that, but I am thrilled about the prospect of being able to get more vaccine here in Chicago. Again, the faster we have vaccine here, the faster we can move through these priority groups, and some of these decisions about needing to prioritize even within groups become less of an issue. So I welcome the opportunity to have more vaccine available here in Chicago. We will be careful to ensure that there is second dose availability. I think that's incumbent upon us as a health department to make sure that we have that. But this is good news. More vaccine means more vaccine for Chicagoans. We're going to keep pushing it out as quickly as we can get it, and news like that means we would potentially be able to move into 1B even sooner than planned.
That's it. Thank you.
Thank you.